Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am glad to be back in the sunflower for a new season. Happy New Year. But before we all sing that Auld Lang Syne song where we say goodbye to 2025 and hello 2026, whether you're feeling super energized from your red light therapy we talked about last season, or you're just shaking off your holiday glitter, I really want to thank you, our listeners, for tuning in. And thank you so much to those of you who subscribe and donate. And of course, anyone can subscribe for free, and we'll talk about that. So today, I'm kicking off season 4 of the season Speaking of Women's Health podcast. Can you believe it? Season 4. It's really been a great and an incredible journey. And we're really grateful to all of our followers, our loyal listeners who've supported us from the very beginning. Your encouragement, your feedback, your enthusiasm inspires us to keep bringing you empowering content. Because our motto is to be strong, be healthy, and be in charge. And so thanks for being part of our speaking community, and we can't wait to share what's ahead in season 4. But before I get into that, I want to go over some highlights of 2025. And on our speakingofwomenshealth.com site, we post breaking news. And this is good to bookmark on your phone or your computer. And certainly some big news everyone seems to hear, but not always. And 2025 marked really a landmark news in women's health. Now, in my opinion, it was over 20 years too late. I have certainly been beating the drum about the benefits of menopausal hormone therapy. But there's lots of important news. Late last year, just as we were entering into 2025, a common contraceptive, injectable Depo-Provera, was noted to be potentially linked to a heightened risk for certain types of brain tumors in women. And Depo-Provera, the generic name is medroxyprogesterone acetate, and it appears to increase the risk of intracranial meningioma 5.6-fold if used for longer than a year, as reported by researchers in the British Medical Journal. Now, the absolute risk is still low because this type of tumor is low, but it does highlight that this is a risk, and we have lots of other contraceptive options. Now, the researchers warned that it was an observational study, so it couldn't 100% draw a cause and effect link. So for some women, they still may want to choose this, but it highlights that we need further study. And of note, progesterone receptors are present in over 60% of meningiomas. That's a type of brain tumor. And so a lot of women who want very individualized hormone therapy, who don't need progesterone, for instance, if they don't have a uterus or endometrium, it does give pause to just throwing in extra hormones. There has to be a reason for what you're using. Another major news item that we highlighted in entering into 2025 was that levothyroxine, a very common medicine, actually it's one of the second most commonly prescribed medications among adults in the United States, may be associated with increased bone loss, even when used at the therapeutic replacement doses. Typically, we aim for a TSH around 0.4 to no higher than 5. And we've known for a long time that too much thyroid can thin the bones. But this study saw that even in participants who were taking levothyroxine within the normal range, when they were followed up for 6.3 years, they had lost more bone density. And 1 in every 8 women has low thyroid. On a happy note, in 2025, the Mediterranean diet was named as the healthiest diet for the 8th year in a row. And it's similar to the DASH diet, rich in whole foods, also plant-based, olive oil. And so really the big news for the last few years have been the GLP and GIP agonist weight loss medications. They've really shaken up the whole diet industry. But really what's most important is healthy eating. The United States Surgeon General issued a new advisory on the link between alcohol and cancer risk. And in January, a lot of people will do dry January. I think that's a healthy thing to consider doing, especially if you've had a lot of celebration at the end of the year. And if you didn't catch our podcast on alcohol and alcoholism in season 3, that's a good one to go back to. Also in the news was that the FDA banned red dye number 3, a common artificial dye used in beverages, candy, and other foods. It has been linked to cancer in some animals, and it was used in lots of foods for children like candy and cereal and cherries and strawberry flavored milkshakes. In fact, I did a podcast on banned foods in other countries and food freedom, and a lot of the things in our food supply in the United States, I mean, we're making some progress, but we have a long, long way to go. And red dye 3 was approved for use in foods back in 1907, and it's made from petroleum. Also, that's gotten a lot of attention, that's kind of petroleum based, are seed oils that are extracted from plants that are very inflammatory, like cottonseed and sunflower and palm oil and canola, which is just Canadian rapeseed oil. And I've done a few podcasts on omega-3s and the fats that our body can't make that we need to be exposed to. Another topic that hit the news in 2025 is what everyone needs to know about radon exposure and lung cancer. Because every 2 minutes, someone in the United States is diagnosed with lung cancer. And lung cancer is a very common cause of cancer deaths, and we're seeing it in younger ages. Non-small cell cancer as well as small cell cancer are concerning. If you've never heard of radon gas, you're not alone. A lot of Americans aren't aware of the sneaky killer that's lurking in homes. It's invisible, it's colorless, and it's tasteless, but it is a risk factor for lung cancer. And when my husband and I built our first home before we had our first son, Stetson Thacker, who's been a recurring guest on Speaking of Women's Health, we had our home tested for radon, and I was so upset when I came in and found out that the builder had opened up the windows because you need a closed environment to assess for your radon gas exposure. In the news also in 2025 was that the FDA approved a nasal spray for depression as a standalone treatment for depression. The nasal spray, Spravato, it kind of sounds Italian, doesn't it, was the first ever standalone therapy for treatment-resistant depression. And we have a lot of information about mood disorders and depression and anxiety on our speakingofwomenshealth.com site. The FDA also approved in 2025 a new type of non-opioid pain medication, the first of its kind in more than 20 years. The drug called Journax, also known as sutrigine, is a non-opioid painkiller, which does not have addictive properties like opioids do. And chronic pain is a vexing problem. And one of the treatments for chronic pain is ketamine. And in season 4, we will be touching on ketamine therapies with endocrinologist, neurotransmitter expert, and anti-aging expert, my friend and a sister from another mother, Dr. Elena Christofides. So that'll be one to tune into in season 4. And if you haven't heard my prior podcast with her on anti-aging, be sure to catch those. So moving on in stories that were very important in 2025, there was an interesting study that showed omega-3 fatty acids slow down the aging process. Our senior specialized women's health fellow, Dr. Nayang Sung, who's trained in OBGYN, family medicine, reproductive endocrinology, immunology, and is now in her second and final senior year of our Specialized Women's Health Fellowship, wrote an excellent column on omega-3 and is doing research in this area. But findings from this large 3-year randomized trial that we have under our news section on Speaking of Women's Health, the Do Health trial, looked at the effects of omega-3, vitamin D, and exercise on healthy aging in adults over age 70. And these interventions reduced the risk of both infections and falls and cancer and premature frailty. The next study was that hormone therapy reduced antidepressant needs in menopausal women. And menopause experts have known this for a long time, but it was nice to see this study out of Texas Tech University Health Science that showed that perimenopausal women and menopausal women with depression, that hormone therapy may reduce the need for antidepressant therapy and or the dose, and lowering the odds of adverse side effects. Healthy vitamin B12 levels may not be enough to ward off neurologic decline. We posted this back in March of 2025. And meeting the minimum requirement for vitamin B12 needed to make DNA and red blood cells and nerve tissue may not actually be enough if you're older. A study from UC San Francisco showed that in healthy volunteers with lower concentrations of B12 but still in the normal range, showed some signs of neurologic and cognitive deficiency. And so I have started to do much more frequent B12 testing. I used to routinely do it by age 65 or younger in people with risk factors for B12 deficiency on certain medicines, family histories of pernicious anemia, or other autoimmune conditions. But now I'm expanding that along with omega-3 testing. We posted information also in March, which is Colon Cancer Awareness Month, and unfortunately we're seeing more and more colorectal cancer in younger and younger people. Cologuard Plus was an improved at-home colon cancer test expected to be an option for people that are at average risk, age 45 and older. So certainly not high risk, certainly not those of you who've had precancerous colon polyps. The next news was on vitamin D. High dose reduced disease activity in early multiple sclerosis. And MS is more common the farther north you go, where we have less sun and less natural vitamin D. And multiple sclerosis does affect women more often than men. The other news on vitamin D was that better levels are associated with reduced risk of dementia. In the news in April of 2025 was the FDA granting marketing authorization of a first home test for chlamydia, gonorrhea, and trichomoniasis. And those sexually transmitted infections, we have a lot of information on our website about, as well as I've done podcasts with several of our terrific nurse practitioners who also practice in the Center for Specialized Women's Health, talking about some of these common problems. We post when there is recalls of various medications, and that's important. And there was a nationwide recall of a common antibiotic due to microbial contamination. And so that's why when you're ill and your physician or nurse practitioner doesn't think that you need an antibiotic just yet, maybe you've got a cold, but it's not necessarily a sinus infection, or you have viral type syndrome that generally is not going to respond to antibiotics. It's important not to take medications that you don't need. Now, in July is when things started to heat up in the menopause field. The FDA panel called for label changes and a lot more education on hormone therapy. And there were hearings held. Several of my friends and colleagues had testified. I previously done that at the FDA for years. We've been trying to get those scary boxed warnings off of vaginal estrogen and appropriate risk benefit alternatives. It always irritated me that there was like no tolerance for any possible remote risk, even in the face of massive benefits in symptomatic women. Whereas other medications, whether they're antibiotics or cholesterol-lowering medicines or other commonly prescribed medicines, which actually many of those have a much higher side effect and risk benefit than menopausal hormone therapy, that there was no equivalence in the field. So vaginal estrogen use in breast cancer survivors, we posted on also in July, because there was a conclusion looking at over 5,500 articles that the use of vaginal estrogen in women with a history of breast cancer is not associated with an increased risk of breast cancer recurrence. And we have other non-estrogen options to use for genitourinary syndrome and menopause, like vaginal DHEA, but it's nice to have the option of vaginal estrogen. We posted the docket that was open for public comments on the risk and benefits to hormone therapy. Recurrent uncomplicated bladder infections in women, the American Urologic Association came out with new guidelines, and I was asked in several media interviews to comment on this. And it's very important to use estrogen vaginally in peri and postmenopausal women because it does help reduce the risk of recurrent infection. We posted a study that was featured from the Menopause Society on hysterectomy with both ovaries being removed, showing a slight higher risk of stroke in women having a hysterectomy with both ovaries out. And certainly to take out healthy ovaries is something we don't usually do, especially under the age of 65, unless there's BRCA gene. And we started off 2025 with a very interesting podcast interview with Ryan Noss, a geneticist, talking about the GINA law. And I have a lot of patients with genetic predispositions to cancer. And so those discussions have to be very individualized. Big news came out at the end of October of 2025. The FDA approved a non-hormonal agent, which is not just an NK3 receptor antagonist, but an NK1 and 3. So we've had Veozah, which is fezolinetant, as a non-hormonal excellent option to treat hot flashes since May of 2023. And now we have an NK1, NK3 antagonist, which is elezenitant, also known as Linquet, which just hit the market. And it's so nice to have both hormonal and non-hormonal options to treat hot flashes, to treat osteoporosis, and to treat genitourinary syndrome of menopause. So no postmenopausal woman needs to be left out in optimizing health and longevity, which is definitely a theme in 2025 and will definitely be a theme in 2026. And finally, the biggest news on November 10th was when finally, the FDA liberated women's menopausal hormone replacement therapy. And in the podcast interview that I have with Dr. Elena Christofides, she thought that we would talk about that a lot, but we talked about ketamine and infusions and boosting energy and anti-aging therapy. And what I said was it's so anticlimactic for me as a trailblazer in midlife women's health that I had been talking about this and writing about this and podcasting about this and educating about this till I'm about blue in the face. But with all that media attention, because a lot of people, fortunately or probably unfortunately, get a lot of their health care from these little sound bites in the media. In fact, the Women's Health Initiative, the infamous Women's Health Initiative that was published on July 10th of 2002, really kind of set the tone for doing little sound bites of a scientific study, but kind of unscientifically interpreted by these little sound bites. And really, your health is so important that we don't want to just relegate it to what some media talking head talks about. Yeah, that is for sure. And you've been listening to the Speaking of Women's Health podcast, our first episode in season 4. I'm your host, Dr. Holly Thacker. And we have so many great podcasts lined up for season 4. We're having a dermatologist and laser expert, Dr. Taryn Murray, back. She's going to talk about skincare. We're going to have a new guest, Vince Whalen of Wadsworth Family Physical Therapy. He's an expert in physical therapy, and we're going to talk about the importance of physical therapy. I've been trying to get a physical therapist on the podcast. I think I probably asked 5, and Vince is the first one to finally say yes to me, and that's a great one. And on today's episode, I want to just go over some resolutions about being real, sustainable ways to make 2026 your healthiest and happiest year from a physical perspective, emotional, and mental perspective. So beyond resolutions, we all want to have intentions that stick. So how many of us say on January 1st, we want to lose 10 pounds only to forget about it by February 1st? So rather than just focusing on some rigid goal, I think it's important to ask yourself, what do I want to feel more of this year? And what things can I let go of? And what brings me joy, peace, and energy? Maybe your intention is to prioritize rest, focus on relationships, as well as advocating for your health and your family's health. And these are really powerful goals that go well beyond just what the scale says. Now, preventive care is very important, and there are some key screenings and tests. The pap smear. It's very important to get this every 3 years under the age of 30. And by age 30, we usually pair it with an HPV test. Now, the kind of bottom basement care is every 5 years, but I see so many women who are educated, they're interested in their health, they have access to health care, and yet it's 7 or 8 years and they haven't had a pap. So in our center, we like to get a pap smear every 3 years. Now, if your HPV is negative and it's 3.5 years, okay, that's probably fine. But getting a scrape of the cervix is not the same as a pelvic exam. So you may need to get a pelvic exam without a pap. And it's very important to keep a record and keep track. And I always tell my patients that even though everything's on the computer or they try to look at it on their phone, but then they don't get internet access, or there's a power outage, or, there's cyber attacks, anything really important you should have a hard copy of. And it's very important to come prepared for your visit to get the most out of it. Now, breast cancer screenings typically start at age 40 to 45. It can be individualized every 1 to 2 years. There may need to be more intensive screening for women at higher risk, women with gene mutations, women with very dense breast. Colorectal cancer is very important. We're starting that now at 45. There's colonoscopy. There's also stool-based test. By age 65, all women should have a bone density to check their bone mineral density. And increasingly, many places, and I've certainly offered this since 2021, are looking at trabecular bone scoring or the bone architecture. Every adult should know their cholesterol and their blood pressure starting in their 20s. By age 45, we need to screen for sugar diabetes sooner if there's risk factors. Also in pregnancy, this is done. Depression and anxiety screenings are very important. And having an annual wellness visit to go over medications and supplements, discuss health concerns, changes in lifestyle. Daily habits for a happy, healthy life, hydration. Aim for 6 to 8 glasses of water a day. Always drink fluids before you eat. Some people are thirsty and they think they're hungry. Prioritize sleep, at least 7 to 9 hours of sleep. It supports mood to metabolism. Movement, whether it's yoga, we've had some great podcasts on exercise and yoga, or just dancing in your kitchen. It's important to move. Practice gratitude, whether that's a gratitude journal or writing notes to loved ones, can really boost your emotional resilience. Decluttering your mind, try meditation or prayer, or just unplugging from all electronics. Connections. Keep up strong social ties. They are linked to longer and healthier lives. And be familiar with your health portals. Stay informed and engaged. Track your test results. Joy and purpose. Health just is not about lab results. It's about living with purpose. So I challenge you in 2026 to say yes to things that light you up. Say no to things that drain you. Laugh more and worry less. And remember, you are your best advocate. Thanks for joining me in 2025 and welcome to 2026. If you found this episode helpful, share it with a friend. Leave us a review. Hit the 5-star button. And speaking of subscribing, I just want to take a couple minutes to go over how to get notified when there's a new Speaking of Women's Health podcast. I have some friends and patients who really want to listen to the podcast, but unless they're prompted and they only see a little snippet on Facebook or a little reel on Instagram, like for the longest time, my husband thought that was just the podcast when he's scrolling on Instagram. No, that's not it. You really have to subscribe, and it's all free. If you have an iPhone, go to your Apple Podcasts and open up that little purple icon and just search for Speaking of Women's Health. Everything we do on social media is Speaking of Women's Health. You can use your little microphone if that's enabled and just say it instead of type it. And once that purple icon with the microphone comes up, you can just hit subscribe. And if you want to enable notifications, you can go to settings and turn on notifications. That way, every time there's a new podcast, you'll be notified of that. And at the bottom of the notification page, there's a little link, and you can make sure that that's turned on. Now, if you have an Android phone or if you're using Spotify on an Android phone, you open up that little green Spotify app. You, again, in the search button, type or say, Speaking of Women's Health, and you click follow to subscribe. And if you're already following, it will say following. And to receive alerts or notifications, you just click on the bell icon, which is to the right of the follow. So I hope that this has been helpful for you. And remember, our team is here to help you be strong, be healthy, and be in charge. Until next time, I'm your host and the executive director, Dr. Holly Thacker, and this is the beginning of the 4th season of our Speaking of Women's Health podcast.